Jason Nichols, who joins us now live from Maryland. He's a lecturer on African American studies at the University of Maryland. Jason, it is great to have you back and on really such an important story, no less. How do you explain those figures?
Well, I think you hit the nail on the head that there are longstanding social inequities uh, that go beyond just coronavirus. When we talk about the fact that African Americans are more likely to be poor, they for generations. It's gotten a little bit better since Obamacare, but for a long period of time, they were more likely to be uninsured. The fact that there's also mistrust of healthcare, and with good reason, from African Americans, so they don't see doctors. They're more likely to have things like diabetes because we have something called food deserts in our communities where people don't have access to healthy food, so they're eating processed food, which can lead to things like diabetes. They're living in, uh, uh, shelter that's not fit really for human beings, and that's one of the reasons why you get diseases like asthma that are chronic. And then when you bring in a pandemic like COVID-19, it's going to exacerbate those diseases and cause massive death amongst African Americans. And you brought up Chicago. We've seen it in Milwaukee, where 81% of the deaths in Milwaukee from COVID-19 are African American, despite the fact that African Americans only make up 27% of the population. And in Louisiana, where they're 33% of the population, they're 70% of the deaths. So we've seen this going from state to state. And even the president, who has had his own issues with race, has acknowledged that this is a problem.
You're absolutely right. The president did mention that earlier. He's saying, why is it three, sometimes four times a number? He goes, it doesn't make sense and I don't like it. He said, we're hoping to have statistics on that in the next 3 to 4 days. That is one of the problems about all of this, is the fact that federal officials and states are not keeping track or releasing racial data on coronavirus victims.
Right, that's a big problem. You don't know how to combat things if you're combating them blindly. And one of the ways that we can have more information about how to combat coronavirus or COVID-19 is to have all of the information. I think there are some common sense answers as to why it affects African Americans, so strongly. Number one, social distancing is oftentimes a privilege. When you live in an area, particularly a crowded urban area, you're not able to socially distance yourself from your neighbors because you live closer to them. Many people work jobs where they're unable to have that kind of distance, and they still have to go into work. So, I think that many of those reasons that we've seen show you why it's spreading amongst African Americans and why it's causing so many deaths. Still, we need the data in order to fight the disease.
I want to pivot for a second, Jason, to another aspect of all of this. There was a French doctor who had called for vaccine testing in Africa. There has been a lot of pushback on that. The WHO has slammed the scientists for even suggesting that a vaccine be tested there. But what's the wider impact of even the suggestion of having a vaccine tested in Africa?
So, well, I can tell you from an African American perspective, we have a history of what some people call medical apartheid, and that is where there's been experimentation upon Black bodies and other vulnerable populations, the elderly, the people who have mental issues, people who are, incarcerated. And so there's a history of that, which has made African Americans less trusting of medicine. So then they don't go to doctors, they get sicker, and then they go to emergency rooms where it's already, an issue where they could actually pass away, where it's, diseases become so advanced that they're difficult to treat. So, and we have a history, of course, many people are familiar with the Tuskegee experiment, where essentially for 40 years, doctors were pretending to treat Black men for syphilis, and it turns out that they didn't treat them at all, that they were just observing to see what would happen. And this is long after there was already a cure for syphilis. So when these kinds of things come out, and then you have this French doctor, and I use the term doctor loosely, he's shouldn't even be a physician, comes out and says these kinds of things, it makes people less trusting of doctors, less trusting of medicine. They go out, they infect other people, and then you have a serious pandemic on your hands within Black communities.
Jason Nichols, we really appreciate you coming on to highlight both of these issues. Thanks for your analysis as always.